All right, good morning. This is Senate Health and Welfare. It is the day after the eclipse, April 9th. And I hope everyone saw totality, or nearly so. It's amazing. Oh. It would be nice if we had an event like that every day. And the traffic on the roads, even this morning, is continuing. A lot of people came up. It was neat. Kind of neat. So, this morning, we've invited our fiscal officers in to talk with us, give us a view of what is in the budget. And I know that one of the issues that we have around the budget this year is there's a lot of recommendations that have been placed in the bills. We have some of those bills in our committee, and then there's the housing bill. So there are bills that have appropriations embedded, and some of those are in the budget, and some are some bills. And I don't know where everything is. And then there are things that folks have testified to at our public hearing, our budget hearing, and some of those requests are not in the budget. So we obviously don't have the time that the House has to do a full in-depth analysis of all the asks and all the requests for appropriations. But we certainly have heard from folks, either through email or conversations. I thought it would be helpful for us to understand what is in the budget and ask Nolan to help put that together for us, which he is very graciously said yes to done, and we appreciate it very much. So what we'll do is we'll go through what you folks are joint fiscal is bringing us, and then we'll have a short committee discussion about our interests in whatever we can help with when it comes to the budget. So why don't we let you all introduce yourselves for the record, and because we know everybody knows everybody here, and then Amy or you. I may not know you. And so we're going to introduce ourselves first. So Jenny Lyons, Senator from Chittenden Southeast. So,
Dave Weeds from Proctor, representing Rutland County.
Good morning, Martina Rock-Hewlett from Berlin. Hi, hello, I'm Grace Hardy from the Addison District.
Morning, I'm Terry Williams from Rutland District also.
okay, so you know. Okay, so go ahead and introduce yourself to the record.
Yeah, for the record, I'm Maria Blair and I staff the House Appropriations Committee. And I also work for the Joint Fiscal Office.
And for the record, Nolan Langwell, Joint Fiscal Office. So today we're going to kind of give you a high level overview of what's in the House passed budget specific to areas that we felt are within your jurisdiction. Just to kind of set the stage a little bit. We put together, Amy put together a very high level overview. We're going to walk through a little bit. We're going to focus on some certain areas, but what we cannot do on a lot of these is you can go ahead and ask questions. But you know, the House budget was the House Policy Committee took testimony from advocates and others, heard and then made recommendations. And we weren't always in the room on those things. So if you will say, you know, talk about something, but you might say, well, what can you tell me more about that project? And maybe yes, or maybe we can't, because we're just trying to give you a high level summary. And that's where you'll try to have to get information outside of us for that. So this is just want to set the expectation that we are not in depth on each of these pieces because we came from all over on the House side. So we thought we would kind of walk through at a high level, and then we would maybe focus on a few things we think are of interest, but I don't think we're going to take 2 hours.
That's okay.
But we're available to try to answer questions the best we can, but I think to the chair's point, it's probably going to be more of a discussion amongst you rather than questions for us. So you should have this document. It's posted. Send it.
It's not on our website.
Okay.
Yeah.
would,
Did Kiki have it?
I thought it was, sorry, I sent 2 documents and I assumed you were going to send me this because I was, so
Okay, we can,
apologies for that.
we have, apparently we're going to have time. That happened.
Sorry, this one,
Yeah, I mean, I just, one of the things that we've been trying to communicate is, the environment that we're working within regarding revenues. And so we've, sent memos to all the House standing committees, and the first thing put in the memos was that, in fiscal year 25, the general fund revenues are expected to be 17.9 million below, 24. And in fiscal 24, we can, we'll just jump to the highlight. In fiscal 25, the revenues are $111.1 million below the 23 revenues in the general fund. And so that's created a really tight box for all of you to work within. And I think that is the reason why there's conversations about other revenue sources. That's all I have to say right now.
Okay,
Okay. So this year, our revenue is stable, up, down, as compared with last year.
It is 17.9 million below 24, what's projected for 24.
And next year is projected to
And
be,
in 25, if we compare it to fiscal 23, which is sort of our benchmark here, is $111.1 million below 23. So,
significant, isn't it?
yeah, and as you recall, we had really robust revenue collections back in 23, 22. So it wasn't like business as usual, but, we have to remind ourselves that we're in a more normal state.
Can I ask a question? Are we doing questions now or are we?
Well, yeah, if it's, yeah. so-
About revenue. So is that all revenue sources? Does that include federal or?
Just general
what is
fund.
it? Just general
Just only the
fund?
general fund, yeah.
And from what types of revenue? I mean, have you
So-
broken it down? I'm
So it's the total general fund and the revenue forecast, which if you're interested, you can find on our webpage, but the biggest source is the personal income tax. And we have corporate taxes, there's a variety of different tax sources in the general fund.
I know that.
Yeah,
I'm asking for the breakdown.
Okay, so I'm not the revenue person, but I can absolutely get you the answer.
Okay,
Yeah,
thank you.
we did have, as you recall, very robust revenue collections, like I think it was in 22 and 23. So it gave us the ability to have a lot of one-time spending.
Yeah.
Yeah.
Okay.
Okay, so which documents should we have?
you should have this handout, and then I also sent, the opioid abatement special fund balance sheet, because I think that's a piece that I was going to talk to. And then I also just sent the H721 fiscal note, because that's, when they build the budget, they think they take into consideration bills that are moving, and the 2 bills that are of major consequence to the budget in your jurisdiction are 721, which is the Medicaid expansion, and then 879, which is the housing bill. However, that fiscal note is, it only got the actual final bill only just got posted, and I was going to my fiscal note and editing, so I didn't send that to you, but you're gonna have it for tomorrow, because you have Representative Wood coming in to talk about 879 anyway.
Right.
We won't go into too much detail of it, but we are gonna talk about the money a little bit, because the housing is a huge piece in this too. But as a matter of fact, I might as well just jump into that piece right now.
Yeah.
And again, you can ask some questions about the funding, but there's still some unknowns in there. But in the governor's budget, we had 7.5 million base general funds, and this is for the emergency temporary shelter fund, it's what we'll call the GA housing. Then there's also, the governor added 16.5 one time. And then he also put in 840,000 in for security. So that left a combined base of 13 14, 20, I forget.
It's 24 plus the security.
That's right, 24 plus the security, and then the House added, so then we thought at the time, the initial estimates were that it was gonna be $49 million program, so we need 40, so, and I'll get into the details later, but to cover that cost, the House added $20 million in contingency funding. Basically, if the money's available to be able to do that. That bill, there's still some, after we passed the bill, or after the House passed the bill, BCF had more refined in for us. And so my fiscal note, which I can talk to tomorrow or the next day or whenever you need me to, will kind of flag that the House fiscal note or the House assumptions have changed. So the bill that they passed changed, but this is what's in their budget for housing. And we can talk more about it tomorrow when Representative Wood comes in. Another thing I want to flag is the CCFAP. You probably heard about this, how there's they took 10 million for 24, and that's, you've already done that efficiently. Or cut 10 million, because when we did our estimates, there's no program for which we have to base those estimates on. So we used a lot of the RAND calculation, population, et cetera. And so we had a range of what we thought it would be. In BAA, I think the governor proposed and the legislature went along with reducing it by 10 million because the program rollout, et cetera. The governor in his proposal had reduced it by another $9 million. And so they presented that to, after they'd done that, the DCF folks presented to Joyce and I their assumptions and where they came up with them, and they are completely within reason for us. So we don't have any particular issues, again, because we're operating in a realm of lack of information on the ground, so we move forward. However, the House concern was that it was 9 million out of base, and they took that 9 million and used it one time elsewhere. So it's not like it would be able to come back. So the House's concern was, well, we want to make sure that that money remains in the base once the program's up, so that if the money's needed, we're not trying to find that 9 million. So the House put that 9 million back into the base so that it's there if needed. That's another issue. What else do we want to flag?
Did they use the one-time 9 million for other things?
Yeah, we had 9 million in the base, they took it, used it one time elsewhere, so we couldn't, if it was base and they just did it one time, oh no, they moved it into base elsewhere, sorry. So if it was one time elsewhere, we could have recouped
Yeah,
it
well,
Right, but the House, they put
They put it
the
back-
9 million in.
back into the base.
Into the base, but did they, that one-time $9 million savings, did they move that to other one-time expenditures?
So, yes, what they did was they looked at, the total revenue that was available and they spent it in various places. And so, yes, it just, savings, however you want to characterize, they get absorbed elsewhere in budget. So, yeah.
The other thing that the House did was, they wanted to, fund syringes. And initially, I think they wanted to use the evidence-based fund that, the manufacturer, we've done some conversations on this. I think I might even talk about this in this room a little bit. And they, it was determined that the evidence fund was, well, legal counsel felt, and I agree that was not it created some risks, using that particular money for that particular cause. So what they did was to free money and there wasn't enough room in the opioid. So what they did to free money in the opioid fund was there was in the Act 22, there was 1.98 for naloxone. So they moved that money, that 1.98 out, and that gets funded in the evidence-based fund because that was a much clearer use of it. And that freed up the money, and they put the one syringes into the opioid fund. So they just kind of moved money around to create
a switch.
because the naloxone was called, determined that is a more appropriate use for that fund. So there was some moving around of fund money to cover that particular priority in the House, because there was, the Human Services determined that they felt that funding syringes was a high priority.
So I'm just gonna add one thing on that. As you may recall, in the adjustment bill, the legislature added for the syringes some tobacco funds. I think it was 218,000. And then already in the governor's budget for 25, you had 100,000 that go to aid service organizations that can be used for prevention purposes, including syringe. And then there was an additional 300,000 specifically for syringes. So what the House did was they took those numbers, that the 400,000, and added the 1.1 in the opioid settlement.
And just to be clear, the million for what you're saying is syringes, it's not, it's for the syringe service providers, correct? For their organization, not $1 million for syringes themselves. It supports the
Yeah.
syringe service
That's right.
provider
That's
organizations,
correct.
their staffing, their work. It's not just buying a bunch of syringes.
Proper clarification.
Yeah, thank you.
Yeah.
Sure.
Yeah.
Good point.
Yeah, and there's language in the House passed bill of B 312 that talks about that. Exactly.
Yeah, because they do a lot of work beyond just.
Of course they do, yes,
Syringes.
yes.
No, I went too long. Okay, one of the things that the governor had in the DEVA budget was, how much was it for the pilot programs? It was,
3.9.
so 3.9, this is part of the pilot that is in conjunction with the AHEAD model. And the House pulled that out, took that money out of the budget. And then, yeah, it was 3.9,
Yeah, so
9.3 million gross.
yeah, 3.9 general funds, and I don't know if you all received the DEVA book. You do.
We have one here,
Okay, so if you ever want to read more about it, it's on the bottom of page 49.
okay.
And that describes this as program. And that is what the House decided not to fund.
And that was money from what One Care for the implementation of the new pilot program.
Okay.
So what else did we want to flag in here? There's $1.3 million for the VNAs, and if you've heard about the LUPA, if you have the Medicare low utilization payment adjustment, this is the $1.3 million in global commitment to DEVA to increase reimbursement rates for the skilled nursing. This has to do with matching to Medicare. And so they funded that. Let's see what else.
And I'll just note that that was a request that we House Reparations received from the VNAs. And that was funded.
Yeah, that was not in the governor's recommend. And if you maybe do or do not recall, but last, I don't know, couple budgets in CAAs, they've had to come in because their cycle is different. So like they was in PAA, they asked for it in the last budget, they asked for it in the last PA before that. So it's been a constant every couple of years.
So what would help, I think, is can you put this memo that you have, or this page up on the screen, so that as we're going through it, you can identify the exact line that you're talking about, for two reasons. One, us, but two, there are people out watching on Zoom who might benefit from that.
I have to really do that.
Oh, that'd be great.
So, and I assume I have. And, we weren't gonna completely walk through the sheet, though.
No, the highlighting is good, and
Sure.
how the base is being affected. There's so much going on with housing. Huge. And this is only part of the budget. We're looking at our part of the budget, which is a large portion of the budget. but there are other things that are not here. Other departments and agencies.
Yeah, and, you can get a lot of information off the Georgia Fiscal Office webpage as well as, House Appropriations. But, you can also view all the budgets from the departments that are submitted. I like to brag about our webpage, so.
Does,
A lot going on
oops, sorry, Oh, yeah. Sorry. Should be more. We'll blow it up. Is that big enough? Or bigger?
Good.
Okay. Well, what else do we have in here? We have $1.1 million in global commitment to mental health for agreements with the community providers for crisis management. Right here. Right. Already talked about the $1.3 million for Lupa. They provide $2.4 million in global commitment to Dale for Meals on Wheels. I think what happened here was it was in the budget.
So there was $1 million in the base.
Yeah.
And the, there was an inquiry made, about whether or not this could be matched. And it's unclear, but, there is a request to have to either check in to see if it can be matched, but we put the matched dollar for the into it.
And just, and to be clear, like it's to be matched as an investment. And it's a lot less of a intensive process. When you hear about waiver extension, this is like within our global commitment, we have those investments, and this is determining with the feds whether this falls within the criteria of our agreement to be able to match the traditionally non-Medicaid match things. And there seems to be some level of confidence that this would be allowable use under the global commitment investments. Let's see, we did CCFAP already. There is an increase in global commitment to Dale for 10.98 million for DS caseload and DS public safety. And then there adds 4.9 million in global commitment for the statutory nursing home rate increase. And then there's 1 million for startup costs for youth inpatient facilities funded under Act 78.
Nolan, can I just interject something? Back a couple of bullets up. The second bullet on base appropriations says provides 1.1 million global commitment funds to mental health for agreements with community providers for crisis management. So these dollars came from, there was a plan the administration had to provide public safety with, they had a contract with the DAs for 12 embedded positions. And the governor recommended adding another 8, getting up to 20. And House Appropriations took a look at that and they thought, well, we'll give public safety the money for 4 of them. And we'll reduce the appropriation by 468,000 and move it over to mental health and match it. And then allow mental health to decide with the DAs on how to spend that money. So it is 1.1, but I just want you to know there's like a backstory to that. And you might hear about this again as time goes on.
Well, where is the money right now?
It's so half of it, 468,000 is in public safety, and the other 468 general funds matched with global commitment is in the Department of Mental Health.
So, yeah.
Yeah, and that's what this bullet, the second one down, is referring to.
Yeah, no, and I think we've got covered most of what we have on base in this document. That covered the temporary shelters. There's 7.2 million on down housing. I'm on the fourth bullet or fifth bullet. It includes $7.2 million in general fund DCFs OEO for shelter bed expansions. There's $446,000 to fund Spectrum Youth and Family Services, their 10-bed shelter for homeless youth.
So let's just hold a thought for a second and go back up to the nursing home rate increase or perhaps 49.
Yep,
And so that's global commitment. So is that total?
yes, it's gross.
That's everything.
Yeah.
Includes matching. Right?
Yeah, like whenever you see global commitment, that
Yeah.
means it's been matched. If you recall, the way it goes to central office, the GF, it gets matched there, and it gets moved to the department of the full matched dollar. And that would be going to Dale, or the fully matched dollar for the nursing home increases.
So,
Okay, go ahead.
I'm sorry, I keep thinking of things that maybe we should just mention.
Please.
So that the whole issue about rate increases is an important issue to highlight. In the 24 budget, the DAs, SSAs, and a variety of other providers did receive rate increases. And the governor's bill did not include those, and that was a request we've heard in the public hearing, request for that. So that's just hanging out there. The House budget has passed and not include rate increases for these providers. But I just want you to be aware that that's something that is, not in the budget. And it's, people are really interested.
Yeah, there were some recommendations from policy committees for increases for various providers that did not make it.
But the nursing home rate increase did make it.
It's a statutory rate increase.
Yes.
And also, if you're interested in knowing, what rates were increased last year, we have a really nice document on our webpage. I also have a hard copy, but, I don't know if you wanna, I don't know if you're interested or not, but anyway, we do have that material available for you if you wanna be able to see what's happening in Kirkus.
So I'm looking on your webpage, I often have a hard time finding things on your
Yes, okay,
webpage,
yeah,
so
okay.
if you could help me figure out what's the best way to
Okay.
navigate it. After
Okay.
6 years, I
No,
still
I'm
don't
really
know.
glad you're asking this question. I love this question. I've walked many people through our update.
Do it on the way.
Yes, okay.
That'd be great.
So you're gonna run it and I'll just,
We're gonna sidebar.
I'll just talk if that's okay.
That's great.
Okay, so there's two places you can find everything. One is on the committee webpage, but there's also a nice place on the House. Oops, sorry.
Oops,
on the end of this. So in joint fiscal office, we have documents on all sorts of different things, but one of them, if you go to, there's two kinds of budget documents. There's one type is what we,
So we click on subjects.
okay, good subjects, and if you wanted to see what documents, like summary documents we put together for the floor. Sometimes the governor, when he presents his budget, he has like big spreadsheets that are just about the entire budget. Those documents, you can go to the second appropriations and budget. And so that is, and then once you click it on, thank you, Nolan, for doing this. You can go to each fiscal year. And in this case, we're talking about the fiscal 25. And it starts at the bottom with the governor's budget documents. And so you can see, like, for instance, if you wanted to look at his language that he presented, it's the one that's 1, 2, 3, 4, 5 down. And there's a web report that is the document that we put together for each process of the budget development. And it shows, it looks kind of like this. I don't know if you have all seen it. We make it available to the House when we go to the floor.
Called the web report.
It's called the web report. And so it has the governor's numbers, and then it has the House change, and then the House numbers, and then when it gets to the Senate, you'll have the Senate changes, Senate numbers, and then you'll have another column for conference committee once we get to that stage. So all those type of documents you can find in the second drop down, which is appropriations and budget. But now, if you want to look at just the documents that were submitted by departments and agencies, you'd go to budgets by department.
And this is what I use a lot.
Yeah, so, but the thing about it is that it's not. A lot of people have this issue where they're not sure which one to click on, because, you know. So you just have to know that there's different kinds of documents in each one of those drop down. So, you know, if you're interested in human services, you click that on, and the first one at the top is this Agency of Human Services FY 25 budgets up and down, ups and downs. So, Nolan, I don't have a laptop like this, so I don't know how in the world you click even the most basic thing. So how do you click that on? The first one. Okay, so this document is, at the top, there's just summary things, but this document has by appropriations in the budget. So you'll see, for instance, second one down is B301, which is EHS global commitment. You'll see all the changes that the governor is recommending from the FY 24 budget is passed. So when you're in a appropriations committee room, you know, that's one of the first documents you look at for each appropriation, because you can see if there's initiatives, if they're making a big, you know, budget cut, you know, if there's positions moving from the central office to one of the departments, whatever. That's a summary document that's incredibly useful, you know, just as to demonstrate, like I have it brought it with me because and I have it printed out in really big so I can see it, but,
what is that document called?
It's-
Which
that's-
one is it? I'm on.
it's, if you click on human
The ups and
services, you go to ups and downs, and this is an ups and downs for the whole agency of human services. So,
For the GovRat.
for the governor, yeah, that's exactly right. Every department, agency provides these. And so you'll have to go to each function of government to find, you know, the ones that you're interested in.
Does it include their base, because
So, yeah,
the problem with the web report is that it doesn't include what current law amount is and how much, it just starts with the governor instead of starts with the current law.
okay, so the web report does have
Well, there's ups and downs, and so,
both of them.
Yeah.
The web report and the ups and downs should match. So for instance, we're in 301, the total after FY 24 changes, they have, and the general fund line is 648 million. My eyes are not the best, but yeah, see this line up there at the top in the yellow?
658, 749, 655. That's
That's
the,
40, we're on page 4,
we're on page 4.
Yeah.
section B301.
So it takes you from the
Yeah.
base, the idea is take you from the base.
Okay.
And then show you the changes that the governor's recommending in 25.
So is the 648, that's the base funding
For
amount?
just the general fund, but as you see, there's all sorts of other funding sources, I'm sorry.
No, go for it, please.
And then you get to the bottom, if you go to the bottom right hand in the corner where it's green, so you see that 2.2 billion
Yeah.
figure. That's all the different sources of funding rolled up.
And if I can just jump in, so top, you see GF, SF, TOB. So GF is general fund, SF is special fund, so that might be tobacco, it might be opioid abatement, it might be evidence-based, whatever. And then you have your tobacco dollars. Then you have your state healthcare resources fund, which is also a special fund, but that's kind of a relic of a fund that used to be much more robust. Then ID, that stands for interdepartmental transfer, so that might be one department transferring money to another department because you've moved positions or you've moved other stuff there. Then FF is federal dollars. Then you have Medicaid GCF, so that's the global commitment dollar. So in central office, it might show up as the general fund and federal fund, but then in the DCF, if the money's going there, it'll just show up as Medicaid GCF, because that's where, again, everything's matched in central office, and then, so it's often two places in the budget. It's initially in AHS central office, and then it'll show up again as a full MAC dollar later in the ups and downs or within their budgets, at total Medicaid global commitment fund. Then you have your investment dollars. And that's like, for instance, the Meals on Wheels, that's gonna be an investment, so that's a separate line because you want to track that, and that's always gonna be a full gross dollar as well. And then you have your total.
Yeah, and so of course we picked this section that has the most movement going on. But I want the question about the web report versus this ups and downs.
Mhm.
If you look at that number in the bottom right corner, it's the 2 billion. If at the web report that the governor submitted for his recommendation, the total is this exact same number.
Right, but what, the base amount is the 1.99 in the top right corner, is that correct? That's that's the starting point, that's what.
That's the starting point, yeah.
And then the governor increases that by 24.3 million to get to the 2.01 billion, correct?
Okay, so,
Am I getting that right?
so the budget adjustment bill, is budget adjustment included in here? So the 1.99. Yeah, that's the way this thing is designed. That's right. So you add to that, the 24.3 million, you get to the 2 billion, 15 million, whatever that.
Right, the web report starts with the governors.
Correct.
Yeah,
Yeah, that's
and that's what I wanted to see was what is the base, how much is the it's like base, governor, house, senate, final. But it's fine,
Okay, so
it's fine.
you should be able to map these same numbers to the web report. In theory, and if there's an issue with, which sometimes there is, then we have to go back and figure out how to fix it.
But the purpose of the ups and downs is for the governor, when they propose and say, here's the change, here's our proposed change. But once we start doing the House and the Senate, we don't do an ups and downs because it's just, you'll find it in the web report. But you won't find it in the ups and downs, that's just.
So what I'm gonna suggest, this is helpful, I think, for understanding how the budget is structured and where it comes from. But I would like to move on back to your informational page about the current, what's in the budget and go through that.
Sure.
And the whole budget process happens down the hall on appropriation. So now you can see some of the complexity of that process and the work. And just some years, this committee has had a little more time to go through the budget from top to bottom. This year we do not, because so much of the money is embedded in the bills that we're seeing, everything from housing to opioids. And so we're gonna see what's here and what relates to our jurisdiction. And then we've also heard from folks about their interests in asking to be included because they're not. That's the biggest issue.
Yeah.
We were on
Yeah.
the
For
4.9 million global commitment for nursing home rate
Correct.
increase, and we understand that.
Yeah, and to the point, I think we kind of left off on, and that was a statutory one. The House did hear testimony from FQHCs, from DAs, from other folks, asking for rate increases that I do not believe were included in the House. Yeah, now we're on, I think we're kind of through housing and public health, include this, the 1.98 that I talked about, where they did the swap. They moved the naloxone out of the opioid abatement fund into the evidence-based fund, and then there was 6.1 million of the opioid settlement fund is to implement the recommendations of the Human Services Committee. So that is the other handout that I have. And I can go to that as well, but that was basically a sidebar to show, okay, here's, would show what was in the governor's recommended for the opioid fund. And then what's the House is doing specifically, they recommend some changes, not a separate sheet.
So, yeah, and this is also tied up with what we're doing with H72.
Correct.
So let's
Say that. for a
hold
second,
that
when I come
and
back.
come back to it after we've gone through everything else here. Because that will directly influence our decision-making on H72.
Correct, yeah. And then we just have some highlights of some one-time. So again, we talked a little bit about the housing, there's a 16.5, that was part of the governor's rec. You have the 20 million for the contingency that we talked about. There's 1 million to extend 10 DCF economic service positions to support that work. There's 2 million for DEC for healthy homes. There's 1 million in general fund for the housing and community development for the manufactured home improvement and repair program. This is probably economic service. This is probably down the hall economic developments.
Can you-
jurisdiction.
Can you share with the committee about the Healthy Homes Initiative, because it's been so well
I
received?
cannot.
Can't do that, okay, so we won't do that.
That lives in the Department.
It's ANO.
Yes, that's right. So, we put it on this list because it is related to housing, but clean water, things about
Septic.
septic, yes, thank you.
Yeah. The
There-
housing's weird, it's like, there's two housing bills, there's the shelter bill, 879, which is here, and then there's 829, which is the other housing bill, like Senate Economic Development, so there's that close tie, but not quite.
What's our room capacity number?
16, so we're
That's
now
19.
over by 3.
Yeah.
Is the air purifier running?
Oh,
Can we turn it on, please?
This is not relevant to me, so I'll wait outside.
Okay.
Yeah.
That down too.
Okay,
Okay.
so, and one-time agency services, which is. Oh,
Oh, no, sorry, that was not a hand raise,
okay.
just a gesture.
Okay. So there's 483,000 in global commitment, there's match dollars to support mental health urgent care centers. There's 835,000 in general fund for Bridges to Health. There's $400,000.
Can you tell us what Bridges to Health is?
That is a really good question.
Okay,
Yeah.
It came, I believe, I think this came from the letter from House Human Services.
It provides healthcare to folks that may not otherwise have healthcare, new Americans, folks coming.
Right,
Yeah.
it is.
Yeah.
It's immigrant services for folks who don't have access to health. So that's,
I think
All
we're at. There's $400,000 general fund for the Vermont Household Health Insurance Survey. House put this in, they felt, the governor did not make a recommendation, the House put this in because there's a survey that has been, that gets done every 3 to 4 years, looking at the insurance coverage and Medicaid coverage of Vermonters. It's a very useful document. Governor did not recommend it. The House felt this was a very good use of money given we're post-COVID and we're through redeterminations. So there was a good use of money. There's $3 million in general fund for DCF, Comprehensive Child Welfare Information System, otherwise known as DCWIS. And another $3 million provided funds are available through HS to close out the process. There was $332,000 in general fund for the 211 contract. There's 500,000 in general fund and 500 in federal fund to support the summer EBT program. This is actually fiscal year 24, or the C section. And then the same 560,000 general fund and 641 federal funds for non-emergency medical transport.
go ahead.
The EBT, the summer EBT brought this to mind. Did we ever recoup any of that money that we didn't get from the feds around the summer meal program? Do you know?
That's a good question for AHS if we get it. We know.
So this is the program that we heard about. It was in the paper, I don't know, 3 months ago. We're on the list of states, right?
So this is what this is.
This is what this is.
This is a fill in the gap.
It's, there's a federal program that the state needs to see if they can get a waiver to apply late, for these funds, and, DCF, I don't know what the status is right now, but it cost, this 500,000 state funds and federal funds to get our IT systems up to snuff so that we can, have this program. And that's the one that provides summer meals, correct? And is that what you were asking?
That was what, yeah, that is what I'm asking about. So, okay.
So anyway, the governor did put this in the budget and the House included it as well. And like I said, we need to get an update on where they are with, applying for it.
Right, so technically that money should have been coming from the feds, had it all gone to plan originally.
I believe that, that the states, because we needed to upgrade our IT system, there's some issue with an IT system. And the state had to put some money in order to do that. And that was what the issue was to begin with, why the state didn't initially apply during the window.
That's all we have on this particular sheet. I guess.
Okay, so these are all the things that are in the budget or in bills.
These are things we've highlighted. There's obviously a lot
There
more
are a lot- I know.
we highlighted.
What about reach up? Was there any increase for reach up in the budget?
So, the region program did not receive, are you for asking about a benefit increase or?
Yeah, that-
No, there is not a benefit increase in that.
And then, what about parent-child centers? I know they had a,
No, that's on the list of rate increases that didn't occur in 25.
do you have a list of the rate increases that didn't occur?
I have a list of what happened in 24.
Okay,
Okay, and so they're the same entities. This is what's, is it okay if I hand it out or?
yes,
Okay, I know the
absolutely.
committee has different,
It'll help us think.
yeah, this is the one that was put together by, Sarah Clark last year in our office. And she, yeah.
Didn't we pass the reach up increase legislation? We read that?
Last
There
year.
was-
Yes,
Yes, there was,
We increased reach up last year.
yeah, we increased it last.
It's level funded in both that how us.
there's language in the bill that, in the House passed bill, requires, DCF to calculate the rateable reduction given, current cost of housing. I guess the standard need right now, the housing expense is based on a 2000, I think it's 2001 housing cost, which is very far out of date, as you know. A lot of things change in the housing market since then. So you'll see some language in the House passed budget that does require this recalculation, but it doesn't provide any additional money for the fiscal 25.
Okay, I also know that there was a request from the healthcare advocate for some increased funding, and that's not in this current budget proposal. I'm not looking at the sheet here.
I don't believe.
Yeah, okay.
Yeah, I don't believe so. The number for the healthcare advocate is, it's in language and
And then I'm looking at the bottom of the page that you handed out, for provider increases. So there's nothing in this budget, proposed budget so far for designated agencies.
that's correct.
And, what about any changes for recovery centers?
Yeah, there is some money in there for
Yeah.
recovery centers.
Okay.
Yeah.
And then, going through the one-time appropriations, provider increases, so those are all one-time appropriations. So the donor milk center, there's nothing in the budget proposed from the House,
That's correct.
and, Prevent Child Abuse Vermont, correct me if I'm wrong, there was a decrease in the funding for that one. I know it's one-time funding of 300,000 from last year, but what's in this year's budget for Prevent Child Abuse Vermont?
I'm gonna have to get that for you.
Yeah, it's less,
Yeah, I believe so.
okay. And then the SASH pilot extension for this year. You know, if that is continuing,
I think, if it was one time and it's not in the one times,
yeah.
now, I believe it's not funded.
Yeah, I mean, so I think I'm looking at things relating to very young and the very old, and the SASH is certainly something that most people
Yes.
stay at home, which is one of the goals that we've had.
Well, it's in here before $450,000.
That was last year.
These
That's all last year.
represent the current fiscal year, this fiscal
Oh,
24.
right,
That's what you
right,
did this time last year.
Right.
Yeah.
Yeah.
I just wanted to give this to you, give you an idea.
This is helpful.
The
No, that
entities
helps a
that-
great deal.
The House is working with a smaller box this year, so.
Yeah, we're all working on this one.
Yeah, for sure.
Well, you eventually got one of these at 25, huh?
So 25, so the governor didn't include rate increases And the House did not include rate increases, and we're gonna have to, see what the Senate does. And then,
Except for the 4.9 million
for the nursing home.
for the nursing.
Yeah, and that, okay, so that's a statutory rate increase that happens every year. Yeah, you're
Okay,
right.
but it doesn't bring it up. Is that a CPI related increase?
So rate setting in the Agency of Human Services, they do a calculation on a certain exactly how they come to this. I mean, it probably does reflect that, but I can't say that for certain.
It does, an economic
Yeah,
calculator.
Yeah.
So. But if nursing homes were going to be equivalent with rate increases for other folks, including for designated agencies, for example, it would have to be higher than this.
yeah, I do believe the advocates during a public hearing, I think there was a number that was presented.
We did get
Not dig around and find it. And I think that Senate Appropriations does have that information. Do that? I don't know. I'm looking.
Senator Westman is my little pulse back there.
And I,
Yeah, mine too.
and I just see, they recalculated the rates for nursing homes. There's a $9 million increase in the rates, both in the governor's budget and accepted by, the backup to that though is that in, the emergency aid that was applied for in the 24 budget, we approved 17 million in emergency aid. We're already at 17.4. So nursing homes are facing a world of hurt. And you're gonna get into this at some level. The nursing homes are facing contracted nursing is its last year was at $64 million. In 2020, it was at $20 million. So you've got, there's a whole issues. There is a $9 million recalculation to try to deal with it. The question is, if we can't get it done, traveling nurse situation, what are we gonna do?
Lower funding.
But nursing homes are really, the reason I keep coming back to it is exactly what Senator Westman has said. And that is that they're going to fold, they're going to close. And we can't afford that at a time, and we're seeing an increase in the number of senior citizens who need support in that area. And right now, what we're seeing is a backup in hospitals where folks who need nursing home care are in hospitals receiving much more expensive care, and there's no place to send them out into our nursing home world. So if we continue to allow nursing homes to close down, we exacerbate that problem even more. And the SASH program is another one that then keeps people at home as long as they can until they have to go to a different kind of care facility. It's a problem. We are way backed up. Okay, so we have. We haven't funded. Is the diaper bank still being funded through the food bank? I don't know.
That was one time.
Yeah, that was
We
one
did
time.
not put funding in.
So the little programs like the donor milk centers and the diaper banks. And actually Prevent Child Abuse Vermont are all one-time funded from last year. So we need to evaluate if we value those, and we need to let appropriations know that. Questions committee on the page that, I know we could go into a deep rabbit hole on the budget. Which would take some time. Yes.
Just questions with Nolan's hand out. If there was a little coding system where you could actually go in the JFO websites and look at that and give an explanation. I understand budget, but this is totally different to me. I'm not. So I'll do the homework if somebody can point me where.
you're asking for what, the explanation from
Yeah.
each of the agencies and departments? Yeah, that would be on the appropriations committee website. You'd have to go and look where each department is. Amy, correct me if I'm wrong there. That helps.
I mean, to your point, like, there's a lot of information that's presented multiple committees and it's dispersed. Some is on the committee's website, some of it's on ours, and it's a lot of information to manage and organize, and we recognize that always the easiest to navigate. We do work hard to try to come up with methods, but not every method we do works for everybody. And then during the session, there's so much being thrown at you. It's hard to remember, like even just now, I was like, okay, where would I find the committee recommendations to the House Appropriations Committee? It took me to remember how to get there. And when I did, like, oh, okay, well, that makes sense now, but it's a lot of information to navigate, and I know you guys need the information. We try to do our best, but it's.
So I just found, I'm sorry, I'm reading, so we had a public hearing, the House and Senate Appropriations Committee, and we got a lot of, documents submitted, and they're on our web page, on the committee webpage. And we received something from the Howard Center, a woman who's on the board, and I think the question that you had asked was how much would it cost to increase the DAs? Did I hear that? Maybe I'm just.
I'm getting emails from people.
Yeah.
I'm sorry, it's the money, I don't know.
Just for the
I'll find out
DAs
about it.
and the SSAs, the general fund piece, she's saying is $14.6 million, and that's just the general fund piece. And then there's other entities.
Yeah, so the House Healthcare Committee had recommended a 3% increase for DAs and SSAs for the mental health pieces only, and that was 7.8 million gross, 3.3.
Yeah, and this is a recommended for 6.5% increase. Okay, so it's
Yeah,
a different
so-
grade increase. Yeah, of course, that makes sense.
Senator Westman.
Just want to say this from the backdrop, Nolan is right, the House worked with a much smaller box. That the governor's budget and the House budget. The House chose to do their separate tax bills, 3 of them separate. They look to do stuff about homeless, they look to do something about healthcare, and they look to do something about housing. That's the 130 million that's outside of the budget. What the choices that were made within the budget, because there's only $3 million worth of difference in spending between the governor and the House, is they all chose to take all of the designated agencies, the family centers, the mental health agencies, the home health agencies, the adult days they even cut, but basically everything else in the budget that is based up was levy funding. And so the complaint you're going to hear is for all of those designated agencies that are facing 15% increase in healthcare costs. How do they survive? And I would only say at home, I have a mental health agency with 220 employees. They've had a turnover of 60 employees this year, which is untenable. So that the direction that the Senate Appropriations Committee is dealing with the struggle is, what do we do about those things that are base and those things that are in the piece? Would you do that or look to the outside to fund the newer initiatives that have come from us from the House? That's the backdrop. No one's right that within their box of the budget, they were tighter, but they chose a path outside of the budget.
Yeah, to Senator Westman's point, H 721, which is the Medicaid expansion bill, which is in your committee, and 829, which is the other housing bill, which is the Senate economic bill, also have revenue. And then the way it's designed was those revenues for those would fund those other things that are outside the budget. So they're kind of linked, even though they're not. I think 880 might be in there too, I'm not sure. So when you get 721, you're gonna see there's revenue, even more revenue than what's needed in that bill, because they're tied to other bills. So that'll be a confusing piece. But when we come in tomorrow, we'll have the revenue team with me as well, since, I mean, it's those revenue pieces.
So one of the issues and the bills that are in our committee, we will look at from a policy perspective, but have to balance what is it that we can ask for in terms of funding? E72 being one and 721 being the other, where there are some taxes that is down the hall, decisions about how to raise money for the policies that we recommend, but we have to have that in balance. So it's, and as Nolan said, it's outside of the appropriations process, but it will be inside the appropriations process once the bills leave our committee, because they will go down the hallway, both sides of the hallway. Oh, yes, it does get complicated in that way, which is something that we expect
But to be clear,
here, but quite that much.
yeah, but to be clear, the spending in 721, which is a separate bill, has appropriations, is still accounted for in the budget, just not in the budget.
Right, as it was drafted by the House. Okay, first bullet, then party.
No, mine's kind of a general question, but is it fair to say that the organizations are feeling the level funding as if it's a 15% cut? Based on inflation? I mean, that's what it seems like.
Well, they're feeling level funded. I think everyone is feeling inflationary pressures. So if we were gonna do this, we'd have to do it across the board based on the inflation. But that's not how our budget has been done in the past. Scary.
I also would say that it's not, inflation is not 15%, it's just one piece of their budget that's 15%, but that's just one piece of their budget, so it's not,
Healthcare costs,
but that's overstating it. The
Okay,
15%,
well,
yeah.
whatever the percent is, it's still being public.
Yeah, it feels like, because they can't, but it's not 15%. I also just wanna say that those bills, first of all, I mean, they are not outside of the appropriations process. They went through appropriations, they went through all
yeah,
the money.
no, we understand. They're in the House budget.
And they are trying to meet some of the needs that we've been hearing, including, healthcare, which is a huge thing, and housing and the opioid crisis. So to say that they're not meeting the needs and
I don't think anybody said they aren't meeting the needs. I think we said they were. Ordinarily, the way the budget is written, ordinarily, we pass a policy bill. We don't pass taxes that support policy. That is what's different. It isn't different that we pass a bill that requires additional funding. So because we do want to meet the needs of the people of the state. And some of those needs are right here with healthcare or designated agencies or other services. No question about it. Do what we can do. All right, what else do we have? Anything else here? Well, I think Maria, Amy.
Nothing comes to mind. But you are correct, this is a unusual year. There's a lot of pressures. And
Well, looking at $111 million to us next year. Down. Not that. That's raised more.
so Senator Hardy, I think that, I can pull, it's actually on our website, one of those drop downs is revenues, it's got Quebec's revenue forecast, you could go from year to year on the general fund, available general fund, and you can see which parts of the general fund have changed.
different revenue sources.
Correct.
Yeah.
Yes.
Thank you.
Okay. All right, good. Thank you. This is difficult for us this year, because the public hearing was held by the Appropriations Committee and that information, public hearing information is on our webpage can you get that sent over to Kiki?
Would you like all of the requests or just sort of a summary?
The summary would be,
Okay,
that would be awesome.
Yeah.
that'll give us something to, discuss, consider tomorrow.
Yep, I have a summary that I can.
That would be it. Thank you. That'd be very good. Should have thought about that before. Any other questions? So we have, oh, Nolan, I have a question for you. So now we can come back to the opioid, settlement fund and the, just what you wanted, the manufacturer fund. And we've got something from you on our webpage. And we've looked at this a little bit before, but now it would offer clarity to know exactly what's where based on what's in the budget. Where things
Okay,
are
so you want me to walk through the opioid abatement?
very please.
Okay, well, I already want that, so we'll.
So, I mean, I have a hard copy of what Nolan's gonna be walking through. Is that okay to hand it out?
Which hard copy? Yeah.
The
please.
opioid, I mean, some committees don't like, paper.
We like
Like, they
both.
really, I'm good stuff.
We're hybrid.
Okay, good, that's perfect.
We like it when we need it. and
It's
so-
friendly.
Okay, good.
Alright, totally jumped the gun, jumping off the, oh.
Yeah.
Yes.
Yeah, you say, it's just, I feel like a.
Alright, sorry about that. Kiki, I'm gonna try to get back into the
Rich, what do you want this?
Well, anything I gotta find it.
What's, it's that document number is,
And if you're wondering why Senator Westman is sitting on my left hand shoulder,
No, I think
it's
good. It's just gonna be a little bit of a, sorry about that.
your way.
There.
so the reason that I asked Senator Westman is here, is this is his part of the budget. And so we work cooperatively in appropriations, and he has a wealth of knowledge from his years of experience, both in taxes and in appropriations. So it's helpful to have. As long as he's willing.
Apologies for the delay. Alright.
Oh, this is really helpful. Thank you. Maria.
Thank you, Maria, for this. Although that's not how I blow this up with, lots. Okay, that's, okay. Okay, so what we have here, and Maria, do you want to walk through that?
Okay, so we can do it together. Nolan and I worked on this joint effort. So that, in last session, the legislature passed Act 22, and that had some appropriations in it from the opioid abatement special fund, and you see those at the top. So you've got the Act 22 and each section number, the dollars that were appropriated, and then the column next to FY 24, it says House, and you'll see the first section 14.1 in Act 22 had the expansion of the naloxone distribution efforts, and you'll see the words moved. And this is where we went in, when the House was doing the budget, they went into Act 22, amended it, and took that money and moved it to the evidence-based education fund, which is now in section B 312, the budget. And then there was also some other amendments. You'll see they're all in yellow. The 1.5, it had been $2 million, now it's 1.5 for core opiate treatment programs. And then the other thing was the Howard Center Addiction Treatment Clinic, our expansion. They moved $500,000 to that in the amended Act 22 in order to do that. So you'll see that the House total for Act 22 is down because they moved the 1.98 million out. And then you'll get down to H72, and that was a bill that passed the House. It passed out of House appropriations in any case. We had to carry it on the sheet. It appropriated $300,000 from the opioid settlement funds to the Department of Health to study overdose prevention centers. And
Was it opioid settlement funds for that?
yes, it was.
Okay.
The 300,000, yes.
Yeah, the 300. Okay.
Yep. And then the next thing down, the budget recommendations. So this is for FY 25. And there's two columns. There's the governor's 25 recommend, sort of in the middle of the page, and then what the House did. So you can see that in the Department of Health, the syringes in fee 312, which is what Nolan spoke about earlier, there's $1.1 million in there for syringes for that program that distributes syringes. And then you can see that the expanding methadone treatment access at least 3 hubs. The governor had recommended 900,000. The House did not do that. They made some different choices. Then the next two things, the governor and the House agreed upon. Then down to Vermonters for criminal justice reform, that governor recommended 150,000. The House did not do that. Then the next two items, the House and the governor agreed on. And then there was a change made in the expansion of student assistance professionals. The governor recommended 1.4, the House did 714,000. And these you'll find in section B 313 of the of the House passed budget. And then the prevention coalitions, 795,000. The governor did not have that on his list, but the House did. So if you look, the blue line has this new total, all these things that we just went through. That governor was 13 million, 13.1, the House is at 12.6. Then the revenue in the fund, this is we just got the revenue update from the Department of Health. I guess that was back in January. They were saying at that time that it was going to be 13.1, let's say, million. And then we got this other information. It's an amount anticipated in March or April from the Department of Health. And I'm not certain if they received it yet, but they felt pretty certain they were going to get this 987,638. So that brought the revenue total up to the 14.1 million throughout. And so then you see at the bottom the balance. You'll notice the governor's balance of 987. It's that number simply because he didn't have the 987,638 that's anticipated in March or April into the fund. But it's sort of like, this is the information the House had when we were working on the bill.
And to complement that, because of the relationship that's been created between that and the evidence-based fund, this committee has passed a bill S98 that uses money out of that bill.
Yeah.
And then you have H72, which uses money out of the bill and raises revenue. And you have there's one more bill, budget.
Look, minor.
And so I don't have it here and I can talk about it when I come up for S72.
Yeah.
But like, in the absence of any of these policies, there was estimated to be a $5.4 million balance unspent in the fund. But with all of those bills in there, with the changes, that the fund would be in deficit by 2026. So I think that as part of the H72 conversation,
We better look at that.
I will present this to you in more detail because you've spent some of that money in S98.
Right.
And, based on just your bill alone, that there would be plenty of money going through the other bills, and we run into some problems with that fund. So I will come back and have numbers and sheet for you in context of the subject.
Right, and I think based on the testimony that we heard last week from the Commissioner of Health, I'm interested in some changes to H72, and I talked with Senator Hardy about it. She's also interested in that. I think all of us might want to look at how the testimony we heard influences our decisions there.
Yeah.
Okay. Thank you. This has been really very helpful.
Utterly wild, utterly bored.
No, it's a different world to start looking at what the requests are in the budget, and we don't do all of the policy all of the time. We pass individual bills, some of which have budgetary implications, some of which don't. But overall, we want to ensure that we have the resources needed to serve people at our DAs, at our nursing homes, wherever we have, state and public health issues going on. Okay, well, what we're going to do now is to let you go, unless there's questions, committee.
We can rearrange the room, so that's.
Rearrange it.
Now, this is hard for us because we aren't having a public hearing. But Amy, if we can get that public hearing information up on our webpage, and I'll carve out some time for discussion tomorrow on all of this, so the committee can, weigh in on recommendations, and because I know there are some concerns in the room. Yeah, thank you for that question.
Just a process question.
Yeah.
What can we anticipate over the next 3-4 weeks on the budget process? Like when must it be back in appropriations, et cetera, et cetera?
So the appropriations committee is thinking about passing a budget out on Friday or finalizing it on Friday.
Of this week.
Yes, of this week. And so that was a surprise to me as much as it was to you. But we're going to try to work within that very narrow box that we have now been placed in, and we'll look at the bills that we have. And then tomorrow we'll, as soon as we can get that up on our webpage, Kiki will let us know. And we can look at that and maybe come in with a short conversation tomorrow. There's some things that are not in the budget that we care about. There are some things that we believe are priorities in here. So we'll have to just take some time to talk about that.
And that somewhat accelerated schedule is because the committee, that's right. Conference committee needs
Yes,
2-3 weeks to kind of get
whatever
themselves
time,
settled.
yeah.
Okay.
We need time,
You know,
yeah.
it's-
No, you're right.
It's a new landscape.
Because, look at having some of the funding included in the policy bills and having to look at how much revenue we need, having the appropriations committee look at the bills that we pass out and make decisions about, available resources. Yeah, it's very complicated.
Just to add on to my colleague's question, so other committees will have needed to submit their requests before the end of this week to the appropriations.
No, I think as the housing bill goes forward, that's been an integral conversation with appropriations right from the beginning. And so some of our bills are also our evidence-based funding for the OPC. Certainly that's been right there beginning. That's 98. And 171, we've known about that, or 721, excuse me. So we'll work on those bills and know that our decisions will influence whatever happens down there, whether it goes out of committee or whether it's a conference process. Because right now, much of what is in the bills that we're looking at covered in the House bill. And so it will be interesting to see how our bills influence decisions in the Senate.
I get that. So from a holistic perspective, to all the committees, they're looking at a bill that affects revenue or expenditures. Those really have to be socialized relatively quickly.
Yeah,
Okay, they're not. Right.
yeah, nobody's under not pressure. Nobody's not under pressure. There's pressure on each of us, and we'll see what happens. And I'm also going to think about, is there a little more time that we could have to do this thinking?
Yeah, it would have been extremely nice to tell people that they wanted to pass the budget out on Friday. This is the first I'm hearing of it.
Well, that's why you're hearing of it from me, because it's new information.
It's Tuesday. That's ridiculous.
will be going to.
You want to go into executive session and whine about the process? Yeah, this is part of the process. Okay, well, so I'd like to take a few minutes break, take a little break. And then we've got, if we can get Katie to come in earlier, that would
Thank
be
you.
awesome.
Thank you.